Yeah. Okay, this one, yeah, so what was the story? Want to introduce yourself, so, because we have some new members.
Deputy Chief Elston with New Hampshire Liquor Enforcement. So last year, we had passed enhanced penalties for any death-related overservice. This is the same language that was passed at the committee. What happened was we had this bill in and we had the tasting bill in where the students could taste, where we would allow the students to taste beer as if they were brewing or making wine. The bills got crossed and there was actually just a number left out that inadvertently deleted these penalties from the statute. So this is just putting the penalties that were passed back in.
Yes, I have piles of copies of things here. Okay, how many people did not get them?
None of us did.
Okay, 529, I thought I mailed this out to people,
Yeah,
but,
you did.
so some people might have gotten it, but obviously new members have not, so. Okay, if you don't have one, take it, if not, pass the other ones along.
We have two amendments on 529 now.
Okay, exactly, this will be the second amendment on 529. Okay, so theoretically, this is, was current, this was in a bill before, it was never current law, it was never,
No, it was current law. It went into effect July 1st.
right,
I'm sorry, it went into effect before that, had a effective date. So it was only in statute for about 4 months and then it was taken out.
then it was accidentally, okay. All right,
But it is the same exact language that
Right.
was previously passed and
Well,
enacted.
Representative Burge is from judiciary or criminal justice or judiciary, so he'll like looking at this because this has got penalties in it.
Correct.
You want, yeah, yeah, because we did pass it already. Just like funny thing happened on the way to the form. Okay, all right. Any questions anymore? Everybody feel comfortable? All those who are on the liquor committee, please, if you're in support of this amendment, say aye. Aye. Those opposed? All right, that's 529. All right, do I have anything else for 529?
565.
What else do I have for 529?
The tobacco one.
And the tobacco one, okay. So the tobacco one,
565.
Mr. Chair?
Yeah.
Are we leaving 529? Because I had a kind of a general question on
sure, what is your question now? Go ahead.
I was looking at the change of hours from off premises 11:45 to 1, on premises 1 to 2.
You're looking at the original bill.
Yeah,
Yeah, that's gone,
That's gone.
that's gone.
thank you.
We have two amendments.
We-
on this. The hours now say generally.
Yes, no, right. So we had actually already passed a bill previously to extend the hours based upon a local vote, okay? Then they came in with this bill, which was to add and tack on another hour, and that's why we deleted it from the bill. So these two amendments we just voted on are going to replace the underlying bill.
This doesn't mandate on the towns the 3 a.m.
Absolutely not. No, the extension, the current law is 2. If they want to go to 3, the town has to vote for it. Which we're pretty sure that it'll never happen, but, and no, we're never gonna go to 4 o'clock like New York. So, okay. All right, so the third bill we're adding to 529 is,
3022.
what's the amendment number now? Okay, the amendment number is 3022H.
That's for-
No,
No,
that's
2957.
565.
2957.
Okay,
Aren't we working on 565 now?
It says tobacco roll.
okay,
No,
so the
this is still
problem,
590.
have we got this amendment yet? Okay.
Is that the
so
one she's making a copy of?
The 2957, okay. All right, so this is gonna really, you're gonna love this one.
Yeah, I gave, you have it.
Yeah.
Gary, you have it.
Robin just passed it out.
So what happened here is that, back in September, when we became aware of the issue that this also got deleted from the statute, I had put in an LSR for next year. Okay, so that's why when you look at it, this LSR number is 26-2957. Okay, so what happened is that once we realized that we are creating a Christmas tree of liquor issues that are hanging out there, A, and B, how important it is we want to reduce the amount of bills we have for next session. So I can actually withdraw that bill if we pass this amendment to add it to 529. In terms of whether we have the official amendment, we're having that drawn up now. Okay, so, but yes, it'll be, for all intents and purposes, it is the language you see here on 2957, 26-2957.
And this does the same thing. It replaces the original language that was in the statute. It corrects an error. This was taken out 2 sessions ago when we did the alternative nicotine products, when we added those to the statute. Again, there was a number or comma missing, and this inadvertently got deleted. So this is just replacing language that was not supposed to be deleted.
Okay, any questions from the committee members? All right, those in the liquor committee who are all in favor, please say aye. Aye. Those opposed, so moved unanimously. Okay, so that's it now for 529, right? You got all 529 then?
So we're gonna have 3 amendments?
3 amendments right now.
Chairman, because this is part of the 26 LSR,
Yes.
the effective date is January 1st, 27 in the amendment, so we would want to have that changed.
Let's wait to see what it comes over as.
Okay.
So I can either take it up on the House floor or we can take it up in the Senate. But I'll probably, let's see what we end up with when we have these all together. Okay. The last issue we have now, so we move away from 529. Now we're on to 565, which is the VFW one. All right, did everybody get a copy of that? And did we distribute that enough to everybody?
It's 3022.
Okay. Anybody not get a copy?
Are we still in liquor?
We are still on liquor.
Okay, I don't want it.
The only things we did this morning is liquor. Everybody else was, the ducks were in a row.
Thank you.
Anybody else? You guys are all set? Okay. All right. So this one, we're the original bill, which you probably Representative Birch has the original bill in front of you, right? Do you have the original bill? Okay. So the amendment now is that we are saying, because as for me vaguely, inside a VFW there is the members only area, and then there's the general public area. So in the general public area is not really what's at issue here. It's that members only area. And the question was, you had to be a member, so you can be signed in. And then the question is, who could be signed in? Under the current statute, they had to be at legal age to come into that area. So what this bill does is that allows a veteran or a member, who's a member of the VFW to bring in someone who is under 21 into the facility. What we heard in testimony was this is often for giving an award ceremony, and they don't want to use the big room. They wanted to just use the little room, and so this allows mirrors the same language we have right now for restaurants, which is that parent, legal guardian, adult, who, so it has to be a parent, legal guardian, or adult spouse. The original bill said just any member could sign someone in, and there was a little squeamishness about that. All right, and then the next issue, or the other issue, was that that a person who's also under 21, but happens to actually be in the service. And that was the whole reason why at one point in time we dropped the legal age to 18, because of the Vietnam War, and that people were 18 and fighting a war for us, but they weren't allowed to drink. In this case, we'll at least let them into the VFW, and but they still won't be able to drink. But they'll be allowed into the VFW to hang out with other veterans. So, any questions on this amendment? Yes, Representative Spear.
When we,
Yeah. This is 3022. Okay, yes, Representative Spear.
okay, so when, I don't have a problem with a serviceman drinking, although some of the ones I've met should probably not drink, but that's another story. So my real problem, and what we discussed before, was why is this different than if somebody had their kids in a restaurant? And I thought about that, and there is a difference. Based on the testimony we heard, a father was bringing their 5-year-old daughter into the private part of the bar, of the VFW, and giving her drinks.
Giving her drinks.
Yes, giving her drinks. And as a matter of fact, I went to her funeral just a little while ago. She died at 56 from a ruined liver and all the side effects that go on with that. Her father was an alcoholic, and then there are some components of alcoholism that are inherited. If a father would do that to their own kid, now no one else turned them in because it's a private area and these people won't turn themselves in. Whereas in a restaurant, you don't know who's sitting next to you. That could be a cop next to you. You can't, in an open environment, you've got a good chance of being caught. But in a private place, you don't have, nobody's going to turn you in for that. And so I don't trust this bill.
Okay, so, but the key, we had this conversation, and the key element is that the bartender would lose they would lose their license, and the VFW would lose their license if that person.
Yes, if somebody turned them in. If no one turns them in, and they don't rat on each other, if no one turns them in, they can do whatever they want.
But that's true for restaurants.
No, in a restaurant, you're in public. That's what's different. It's the public-facing view. In a restaurant, it's fine because it's public.
But again, we're talking about the bartender.
But
the
who's going to
responsible-
turn the bartender in? No one. These are private clubs. They're not going to turn the bartender in.
Okay, all right.
So I want to clarify something you said. This child that was being served drinks by her father, that was 5 or 6, died at 56. So this event occurred 50 years ago.
At the age of 56.
And so when she was being served drinks by her father,
50 years ago.
was being served drinks by her father 50 years ago.
Right.
So that seems to me that there has been a cultural change in the last 50 years on a number of these things that were considered acceptable 50 years ago that are not acceptable now. That's my belief, number one. Number two, if you've ever been in one of these clubs, whether it's the VFW or the Italian club or whatever your favorite kind of club is, they are, generally speaking, effectively restaurants. They're public. So it's not like you and me and our best friend Maury sitting there drinking and feeding booze to a kid. It is in fact a public place. The access is simply restricted to members and guests, and virtually everybody's a guest in there. So I disagree with you that it's not public, and I question the reasoning that something that happened 50 years ago is applicable to the case today, because the world is so different, in many ways good, in many ways bad, from 50 years ago, that I think that is just not relevant.
I appreciate your comments, but I respectfully disagree.
Could I suggest, Mr. Commissioner, that maybe something like this should be posted in one of these clubs? That, no underage drinking in, I don't know, maybe that would make it a little bit more apparent and a little bit more effective. Just wondering if this could be amended to say that. I don't think they probably have it posted, but.
No underage drinking allowed?
It's no one, yeah. I mean, if I understand, your concern is because we are passing legislation related to a private club, that people in the club are clubby and are all looking out for each other. And so therefore they're going to be apt to look the other way when a drink is given to someone who's underage. And, that is your, in terms of us, how do we enforce it? We already have a law that says you can't do it. In terms of, they say how the enforcement is occurring. The one thing you didn't say is that the liquor enforcement absolutely is stopping in to these establishments, just like they do with any restaurant. And if they see someone underage drinking, then yes, they will prosecute and violate, and
I do
and that
appreciate-
VFW is going to lose its license. So I would think that the bartender and the VFW, which as far as I know, that this is the number one source of their revenue, is probably alcohol sales. That they would not want to jeopardize their establishment by serving someone, doing something that is clearly illegal in any establishment.
Over the years, I've heard a lot about what the liquor enforcement does, and I respect that gigantically, but I also know they've been cut. They've lost revenue and they don't have all the people that they really would like to have. So I question whether or not we're going to be able to do the job that up to their typical standard, if you will. But, I'm not telling anybody to vote for this or not vote for this. This is my opinion.
And
There you
are
go.
entitled to your opinion. Okay. Representative Burge, yes, we do recognize all members to speak when we do bills in subcommittee. Yes. what would
Thank you,
like
and I
to say?
appreciate that, Mr. Chair. I gather there's no verification system that somebody comes in with a bunch of kids and says they're a parent, actually is a parent.
In terms of how you prove that they're your kids, and and you use the plural as though that they brought in multiple kids and multiple. It again is the responsibility of the bartender, of the establishment, the VFW establishment, to in threat of losing their license, that they should make sure that they've asked the right questions and making sure that this guy or that the veteran wasn't just bringing in random people off the street. And
I was thinking more like somebody's babysitting a bunch of kids, decides he wants to go out for a drink, just grabs the kids with him and heads over to drink. I was kind of thinking of, I forgot who said it, trust but verify, some former president. So there's no, so it's trust the bartender on a number of
No,
things.
it's not trust. It's trust from he is the law. They want to maintain their license. They don't want to lose their liquor license. So their liquor license, and that's true for all restaurants right now. I mean, it wouldn't be just limited to VFWs. Under current statute right now, that babysitter could bring a bunch of kids into a restaurant.
Okay, so my other question is more a general question about mandatory versus local control. If a town doesn't like this system, if the town feels in their town they don't want children going into back rooms where it's private and alcohol is served and could be given to kids, do the towns have any ability to say no to these social clubs?
Fair enough. We will have the chief of enforcement to come and tell us can towns have a local ordinance barring barring people coming into the facility.
Thank you, Mr. Chairman. For the record, Chief Mark Armganian, Director of Liquor Enforcement and Licensing. Great questions. I think I can answer all the questions, except for how many ordinances are out there. But it would be at the town level, we always look at local oversight. To even make the license, we need to get approval from the town, the municipality. So in this situation, we're not looking at a ton of like babysitting, a ton of kids coming in. Only 4 can be brought in. At the same, only 4 people can enter that premise under the signature of the member. So there's a sign-in process. You're absolutely right, Chairman. At the end of the day, the same training for that server is identical to what we give to everybody else in the industry on responsible service, and also customers consuming responsibly. Signage-wise, the age restriction poster is still by law at that premise. So there is signage. Did I get all the questions? So at the end of the day, you can there is a sign-in, and there's only a maximum of 4 that are allowed per member to be signed in. But there is a sign-in, and we are in those locations as frequent as possible. At the same time, I would say that bringing in anything nefarious into a club actually does get reported more than in the public as it would be in a restaurant or a cocktail lounge.
So,
To answer the other
Did you
question.
hear that, Representative Spear?
They do. We quite frequently get phone calls from on our tip line from those establishments because the norm is it's a membership of service people. And when this other group comes in or is brought in and they start doing nefarious things like underage drinking or whatever it could be, the membership as a whole has a problem with that because they do see, as the chairman said, they do see a possibility of their establishment being shut down. So they make the phone call. That does happen.
might I follow up?
Okay, but one at a time. Well, it's true. You started the question, so let him go ahead with your follow-up. Yeah.
So just to be clear
Yes.
about the town opting in or opting out or whatever, and I don't know if this goes to you or goes to you, whether that has to be in legislation or whether or not.
Thank you for your question, Representative. So at the end of the day, there isn't an opt-in clause to this like we did with social districts. But there is a trigger mechanism that is in the application process that the township, the municipality, actually has approval prior to doing any approvals on our end. We have to get a letter from the municipality that actually says they approve of this. That's from the fire department, that's from clerk's office, and that's from the police department.
So my question then goes back to the chair. Can a social club say, yes, you have your application, but this statute trumps that application, and therefore you have no right to deny us the ability to do this because this statute says we have 100% right to do it. That's my concern.
And if I can just add to it, Representative, nothing precludes the municipality from affecting their right to an ordinance. So they could restrict further than state law with an ordinance, which a lot
Right.
do take that.
Unless it conflicts
What do
with
you,
state
like
law.
when they call federal versus state, what do they call that?
We're a Dillon,
Primacy.
we're a Dillon jurisdiction.
Right, but I'm saying is that when it comes to liquor laws, okay, that if anybody who, the establishment, if they want to have stricter rules, they can, okay? So the VFW might just have a policy say, no, notwithstanding the
I'm not talking about the
legislature passing.
About the club deciding one way or the other.
Exactly, that's what I'm saying.
talking
If the club,
about, can a town pass an ordinance that conflicts with a state law?
yes.
We're a
Yes.
Dillon jurisdiction, you sure?
Well, in this case, that when it comes to these kind of policies, that yes, as what we're hearing from liquor enforcement, yes, they can.
They can tighten it, but they can't loosen it.
Okay, now, sorry.
Well, and on this theme, as a selectman, and I'm a selectman in my town, every time that somebody does anything with a liquor license in the town of Troy, it comes across our desk and we vote either yay or nay to agree to it. And then we provide a letter as well as there's a place on the form for the select board to sign off. Am I wrong in that?
Correct.
So I don't recall that we have ever not approved an application. Our applications have been limited and reasonable and easy to understand. My question to you is, if the town of Troy, as an example, voted to not allow a liquor license to be issued or reissued or changed, what would happen?
So very good question. Thank you for your question, Representative. This has happened. So let's say a license has been issued, and as course of years go by or a year goes by, something happens that you as a select board sit back and say, you know what, I think we made a mistake. We'd like to revoke this. The letter comes into us, which triggers a hearing, and we have a hearing on pulling that license. There is a process that the licensee gets due process, just like you would want your due process in this endeavor. So there is a process for that. It does happen. It has happened.
So if I understand you correctly, if the Board of Selectmen chose to deny a renewal or a change, we would have the opportunity to come before the Liquor Commission and say, look, for whatever reasons, we don't think these guys are team players. This is not the environment we want in our town, and we don't want it renewed.
You would probably also bring your police department in and
Oh,
those calls for service. Absolutely. That has happened.
Thank you.
Totally on point. Thank you.
Okay. Is there any more questions from the liquor subcommittee on this amendment? All those in favor say aye. Aye. Those opposed? You're on the subcommittee.
Can I make a comment?
Just giving a hint for the future.
Yeah, well, okay.
Can I make just a quick comment? The reason why I voted for it, and I have to say this, is you were very compelling and very convincing. The Liquor Commission, that is. And I trust them, at least the enforcement part of it. So,
That sounds great. Maybe you can convince Representative Birch. Okay, I think that wraps
Sit up,
up the subcommittee.
showtime.
And given the hour, we'll get right into our executive session. Okay. Yeah, okay, so. First bill is 186 relative to legalization, regulation of cannabis and making appropriations thereof. Representative Sullivan moves ought to pass. Do I have a second on the motion? Representative Spears seconds the motion. Is there any need for discussion, or are we ready for the vote? I'm sure everybody pretty much understands what the bill does. Okay, so do you have all the replacements? Yep. Okay, perfect. The clerk will call the roll. I go last, yes.
Representative Patuchik,
No,
Osborne isn't here?
Not here.
Okay. All right. Representative Ammon,
Yes.
Representative Smith,
no.
Representative Porcelli,
No.
Clerk, no. Representative Thaxton,
No.
Representative Miles,
No.
Representative Presa,
Yes.
Representative Long,
Yes.
Representative Hebert,
Yes.
Representative McAleer,
Yes.
Representative Spear. Yes. Representative Birch,
Yes.
Representative Sullivan,
Yes.
Representative Sharisa,
No.
Representative Horrigan,
Yes.
and Chairman.
Yes.
Okay. 10 yes. 7 no.
Okay, the vote is 10
10 to
yes,
7.
7 no.
10 to
As I
7.
say, that'll be on the regular calendar. Will there be a minority report?
Yes, I'll do one.
Yes, the Representative Walsh will handle it.
I'll write the majority report.
Yes, you will.
And the minority motion is ITF,
And Marie is IPA,
Okay, yes.
right?
yes.
Okay.
and it's on the regular.
Okay. Got rid of that one. All right. House Bill 241, relative to treatment of alternatives to opioids. We have an amendment number 2987. And Representative Miles. Oh, I'm sorry. I did. I have opioids. I have opioids as 2987 on my cheat sheet, but am I wrong?
I got 2990 over here.
2990. Okay, so I had it flipped over. Okay.
Thank you, Mr. Chairman. I move ought to pass on HB 241 with amendment, and I'd like to speak to my motion if I may.
Yes, you will. Oh, excuse me. Second by Representative Patusek. So the amendment number is 290.
This bill that individuals living with chronic pain have access to a broad range of pain medication options, management options, including non-opioid, non-surgical, and non-medication treatments. It directs health insurance carriers to develop comprehensive pain management programs to support safer, evidence-based care. The amendment clarifies the insurance department's approval process, ensures educational materials reach both providers and patients, and removes language that could have created regulatory duplication. The majority of the subcommittee supported this, recognizing that it promotes safer alternatives to opioid prescribing, aligns with current medical best practices, and supports patients and providers seeking effective pain control. Please support the motion of ought to pass with amendment.
Okay. Any discussion on the motion about to pass? What's the amendment? The amendment number is 2990. Evidently, I had it flipped on my cheat sheet. Okay. The clerk will call the roll. to pass
On the
On
amendment.
the
on the
amendment.
amendment?
Representative Patuchik,
Yes.
Representative Ammon,
Yes.
Representative Smith,
Yes.
Representative Porcelli,
Yes.
Clerk, yes. Representative Thaxton,
Yes.
Representative Miles,
Yes.
Representative Presa,
Yes.
Representative Long,
Yes.
Representative Herbert,
Yes.
Representative McAleer,
Yes.
Representative Spear,
Yes.
Representative Birch,
Yes.
Representative Sullivan,
Yes.
Representative Sharesa,
Yes.
Representative Horrigan.
Yes.
And Representative Hunt, yes.
Oh, and Hunt, yes, sorry. 17 of us.
Okay, 17, yep, 17 zip. Motion now of Representative Miles, second by Representative Petusek, moves ought to pass as amended. Any discussion on the motion? Seeing none, the clerk will call the roll when she's ready.
Thank you. All right. Representative Patuchik,
Yes.
Representative Ammon,
Yes.
Representative Smith,
Yes.
Representative Porcelli,
Yes.
Representative Clerk, yes. Thaxton,
Yes.
Miles,
Yes.
Presa,
Yes.
Long,
Yes.
Ebert,
Yes.
McAleer,
Yes.
Spear,
Yes.
Birch,
Yes.
Sullivan, Sharesa,
Yes.
Horrigan,
Yes.
and Chairman.
Yes.
All right.
Okay, all those in favor of placing House Bill 241 on the consent calendar, please say aye.
Aye.
Those opposed? Okay, so moved. Next up, relative to HB 297, relative to providing self-funded employer health benefit plans access to their claims data. Okay, okay, so this one is the other amendment, okay. All right, so Representative Miles, second by Representative Petusek, moves the amendment number 2987. Representative Miles, would you like to speak to your motion?
Yes, please. Thank you, Mr. Chairman. I move 297 ought to pass with amendment. And this bill improves transparency and accountability for employers with self-funded health plans by allowing them to opt in to receive de-identified aggregated claims data. This will help employers better understand and manage healthcare costs while maintaining patient privacy. The amendment clarifies how health carriers and third-party administrators must notify employers about the option to receive this data. It requires notice at renewal, and it directs the insurance department to provide annual utilization reports to participating employers. The majority of the subcommittee supported the amendment and the motion, finding it strikes the right balance between empowering employees with valuable information and ensuring strong privacy protections for employees. It's a practical, transparent improvement in our insurance marketplace. Please support the motion of ought to pass with amendment.
Any other discussion on the motion of ought to pass on the amendment? Seeing none, the clerk will call the roll.
And give me the amendment number again.
The amendment number is 2987.
Okay, and this is Bill 297. All right. Patuchik,
Yes.
Ammon,
Yes.
Smith,
Yes.
Porcelli,
Yes.
Clerk, yes. Thaxton,
Yes.
Miles,
Yes.
Presa,
Yes.
Long,
Yes.
Ebert,
Yes.
McAleer,
Yes.
Spear,
Yes.
Birch,
Yes.
Sullivan, Sharesa,
Yes.
Oregon.
Yes.
Yes. Motion carries 17 to zip. The motion now is ought to pass as amended
Okay, wait, what's
on
that?
297.
All right. And this is. All right, Petruchek,
Yes.
Ammon,
Yes.
Smith,
Yes.
Porcelli,
Yes.
Clerk, yes. Thaxton,
Yes.
Miles,
Yes.
Raisa,
Yes.
Long,
Yes.
Herbert,
Yes.
McAleer,
Yes.
Spear,
Yes.
Birch,
Yes.
Sullivan. Teresa,
Yes.
Horgan,
Yes.
Chairman.
Yes. Motion carries, voted 17 to zip. All those in favor of placing on the retained, consent calendar, please say aye.
Aye.
All those opposed, so moved unanimously. Okay. Okay. House Bill 312. Relative to the right, actually, relative to the right of intercollegiate student athletes to earn compensation through the use of their names, images, or likeness. Representative Pressa moves interim study, second by Representative Petusek. Representative Pressa, do you want to speak to your motion?
It's still just too unclear what they're doing at the federal level and what the NCAA is going to do. So I think the bill's a good idea, but just as of right now, we just don't have enough information.
I mean, I guess I would reinforce that. I've always said every bill has a grain of truth to it. It's the devil's in the details. And we have several bills here that are interim study. And the reason they're interim study is that, there is some truth to the subject matter and that we want to keep them in the committee so that we can discuss them. And that is important when you interim study a bill. Doesn't mean we kill it or kill it gently, some people say. That this committee is committed to still keeping that issue and working on it if necessary, if something comes up, so that at least we have a vehicle to work with. Okay, the motion is interim study. Is the question clear? The clerk will call the roll.
Representative Petruchek,
Yes.
Ammon,
Yes.
Smith,
Yes.
Porcelli,
Yes.
Clerk, yes. Thaxton,
Yes.
Miles,
Yes.
Raisa,
Yes.
Long,
Yes.
Herbert,
Yes.
McAleer,
Yes.
Spear. Yes. Birch,
Yes.
Sullivan. Teresa,
Yes.
Horgan,
Yes.
Chairman.
Yes.
Okay.
Okay, all those, vote is 17-0. All those in favor of placing on the consent calendar, please say aye.
Aye.
Those opposed? So moved unanimously. Okay. All right, 359, prohibiting denial of banking and insurance services based on any factor that is not quantitative, impartial, and risk-based as measured by an objective standard. Representative Ammon, second by Representative Petusek, moves interim study. You want to comment on that, or?
Mr. Chairman, we've had similar bills to this, and every one of them has been rejected by us. And I.
No,
would-
can we let him first speak to his motion?
All right.
And then we'll have your opinion. Okay.
I thought he said he didn't want to.
I was getting ready to.
He was pulling his.
Thank you, Mr. Chairman. This issue is being addressed at the federal level. We've heard of Operation Choke Point 1.0, 2.0. These are weaponizing the banking industry for political purposes. That's the reason why this bill was put forward. But I think interim study is the appropriate motion. At this time, I think this is a federal issue, and we're going to pay attention to what they're doing at the federal level.
Perfect. Okay, now,
I would reject this bill. I wouldn't bother studying it. I think it's, you're taking the choice from insurance companies, banking companies that might have other reasons that they don't like the trim of this guy's sail or whomever. I think we should just reject this.
and you are entitled to your opinion. Yes. Okay. Any other discussion on the motion? Representative Oregon.
Yes, I agree that these private businesses, including financial institute and insurance agencies should have some latitude to not do business with clients whose maybe agenda conflicts with their own, and also and I'm also like a little bit uncertain, just given the chaos at the federal level, whether we want to rely on the federal government to do or not do anything that's been doing, or to refrain from doing anything it hasn't been doing. But I think for now we should give we should let these private companies pursue their agenda, even if it's something that like not everyone agrees with. So.
Right. Well, I mean, I would have to say, and this is not the only bill that's like this in our committee. Like even when it comes to the threat of ethanol, being in our gas, all of these bills, in terms of, yes, I certainly am not overly excited about passing, legislation and doing something, but at the same time, this committee is acutely aware of what's in the newspaper and what's news has happened, and we will also discuss that issue when it comes up to the Chinese bill. And so I would say in this case that yes, we like the fact that to have a bill as interim study, so that when a newspaper article comes out or when something happens, then we have a vehicle in this committee can then discuss that issue and work on whether there is we should be looking for a resolution to the problem. Okay, anybody else would like to speak on the bill? All right, the motion is interim study on House Bill 359, and the clerk will call the roll.
Representative Patuchek,
Yes.
Ammon,
Yes.
Smith,
Yes.
Porcelli,
Yes.
Clerk, yes. Thaxton,
Yes.
Miles,
Yes.
Prysa,
Yes.
Long,
Yes.
Herbert,
Yes.
McAleer,
No.
Spear,
Yes.
Birch,
Yes.
Sullivan, Teresa,
Yes.
Oregon,
No.
Chairman.
Yes,
All right,
17 to 2,
15 to 2.
15 to 2, excuse me. Do you two have a problem putting this bill on the consent calendar?
No.
You're okay? Okay, great. All those in favor of placing on the consent calendar, please say aye.
Aye.
Those opposed? Okay, 15 to 2. All right, House Bill 427, relative to amending the Uniform Commercial Code, otherwise known as the UCC. Representative Ammon, second by Representative Patusek, moves interim study. Do you want to speak on this one? Okay. Anybody else would like to weigh in on interim study for the UCC bill? Seeing none, the clerk will call the roll
Wait a minute. So it was.
when she's ready.
Seconded by
Patuchek.
Patuchek. Okay. All right. Representative Patuchek,
Yes.
Ammon,
Yes.
Smith,
Yes.
Porcelli,
Yes.
Clerk, yes. Thaxton,
Yes.
Miles,
Yes.
Prysa,
Yes.
Long,
Yes.
Herbert,
Yes.
McAleer,
Yes.
Spear,
Yes.
Birch,
Yes.
Sullivan, Teresa,
Yes.
Oregon,
Yes.
Chairman.
Yes. Okay, 17 to zip. All those in favor of placing on the consent calendar, please say aye.
Aye.
Those opposed? So moved. House Bill 454, requiring that retailers of fuel blended with 15% ethanol also offer fuel blended with 10% or lower ethanol content. And who did I have? Representative Hunt moves interim study, and seconded by Representative Patusek. And we'd like to keep this around in case we find out if this is becoming a problem. Anybody else would like to speak on it?
understand that retailers have absolutely no way to do this. So it's sort of a wash, total wash.
There was a point in time where they were sticking a lot of corn oil into my gasoline, so. So, yes, yeah.
So I always thought that ethanol was a way to buy votes in Iowa by turning corn into fuel.
Right, right.
So that's my take on it.
Okay. Any more discussion on the motion of interim study? Seeing none, the clerk will call the roll.
Representative Patuchik,
Yes.
Hammond,
Yes.
Smith. Yes. Porcelli,
Yes.
Clerk, yes. Thaxton,
Yes.
Miles,
Yes.
Prysa,
Yes.
Long,
Yes.
Herbert. Yes. McAleer.
No,
No.
I mean, yes, I'm sorry. Pick one. We're talking about something I don't know about.
I would say keep your private conversations to yourself and when we're in the voting mode.
Spear. Birch,
Yes.
Sullivan. Teresa,
Yes.
Oregon,
Yes.
Chairman.
Yes. Okay, vote of 17 to zip. All those in favor of placing on the consent calendar, please say aye.
Aye.
Those opposed, so moved unanimously. Moving right along here. Okay, House Bill 529, relative to the Liquor Commission. Okay, so we're gonna have we actually have 3 amendments.
Yeah.
Okay.
So,
Okay, so we're going to replace all after the enacting clause. And we're going to take up, First Amendment is 2995. 2995 has 2 sections in the bill. One is to allow a restaurant to have private parties. And 2 is to allow restaurants to sell alcohol, mixed drinks, and have the customer take them out. Any discussion on this amendment? Seeing none, the clerk will call the roll on amendment number 2995.
Representative Patuchik,
Yes.
Ammon,
Yes.
Smith. Yes. Porcelli,
Yes.
Clerk, yes. Thaxton,
Yes.
Miles,
Yes.
Prysa,
Yes.
Long,
Yes.
Herbert,
Yes.
McAleer,
Yes.
Spear,
Yes.
Birch,
Yes.
Sullivan. Teresa,
Yes.
Oregon,
Yes.
Chairman.
Yes. Okay, and vote 17 to zip. Second one is amendment number 3042. And this is relative to penalties for people who have been overserved and the penalties to the licensee for overserving. This was legislation, but it got accidentally repealed. And so we want to get it back into the statutes. Is there any discussion on the motion of ought to pass on 3042? So this would be Representative, let's see.
Who is this?
Okay, we'll just, yeah, you can put my name
Okay.
and then put Tuzak.
Mm-hmm.
I'll take responsibility for it. Okay. All right, ought to pass on amendment number 3042. The clerk will call the roll.
Representative Patuchik,
Yes.
Ammon,
Yes.
Smith,
Yes.
Porcelli,
Yes.
Clerk, yes. Thaxton,
Yes.
Miles,
Yes.
Prysa,
Yes.
Long,
Yes.
Herbert,
Yes.
McAleer,
Yes.
Spear,
Yes.
Birch,
Yes.
Sullivan, Teresa,
Yes.
Oregon,
Yes.
Chairman.
Yes. I'm just gonna go. All right. Can we attempt to add it and then? Yes. Right. Okay. Okay. All right.
Jim, what you do is a floor amendment.
Okay. Okay,
All of it, you'd have to merge all of it.
yeah. Okay. Okay, so, for the committee, unfortunately, I screwed up and didn't have this amendment done, got it done for today. It is an LSR right now, but my hope is to bring it up as a floor amendment when we take it up in January, so then we don't have to take on the actual bill that will be coming in. And this is the issue related to another one of those mistakes, the things that got deleted. And this is a tobacco violation for anyone having tobacco under 21. So at this point, because even though we have the LSR number, the LS number has this unfortunately 2026 stuck in front of it. So the amendment number 25957. So just be aware on the first week of January when I get up and make a floor amendment to add this to the bill. This is it. Yes, Representative Oregon.
These first two amendments, which we just voted for, I guess they'll be presented to the full House as a single majority amendment.
Exactly.
Yeah. thanks.
Exactly. Okay, so just put that aside for the moment. So now we have two amendments that passed. So now the motion is ought to pass on 529 with the two amendments. Any discussion with the motion? Seeing none, the clerk will call the roll.
Representative Patujic,
Yes.
Ammon,
Yes.
Smith,
Yes.
Porcelli,
Yes.
Clerk, yes. Axton,
Yes.
Miles,
Yes.
Raisa,
Yes.
Long,
Yes.
Herbert,
Yes.
McAleer,
Yes.
Spear,
Yes.
Birch,
Yes.
Sullivan,
Yes.
Sharesa,
Yes.
Oregon,
Yes.
and Chairman.
Yes. Vote 17 is zip. All those in favor of placing on the consent, no, we want it on the regular calendar. So placing this, leaving this on the regular calendar. Okay,
Consent?
no, because we
Regular?
want a regular calendar because I want to do my floor
Oh,
amendment.
okay.
Okay. House Bill 565, allowing persons under 21 in the veterans clubs, private clubs, and social clubs under certain conditions. Representative Patusek, seconded by Representative Hunt, moves ought to pass
Wait, slow down.
on
Slow
the
down.
amendment.
Jeez.
You know,
Yeah,
I'm very bound and determined to get this done within
Yes,
the hour,
I hear you.
I have a reputation to maintain.
All right, 565. So there's no amendment, right? It's ought to pass.
So this is amendment, ought to pass on the amendment. And the amendment number is 3022. Okay, is there any discussion on the amendment?
Just,
Yes, Representative Birch.
just briefly, in trying to keep you into the next hour. Just to express my concern that I would prefer a bill that had in it language that clarified the local option, so to speak, because I think there is a Dillon rule problem as it's presented.
Okay. And as we heard in the testimony that the Liquor Commission already has the wherewithal in this to do that. So we don't have to write down on every single one of our liquor statutes to have that paragraph added, because we've always intended that we have local control when it comes to liquor. Because there are towns that are still dry in New Hampshire. And that's their choice.
Absolutely.
Okay, so the motion is ought to pass on the amendment. Any more discussion on the motion? Seeing none, the clerk will call the roll.
Representative Petrucci,
Yes.
Ammon,
Yes.
Smith,
Yes.
Rocelli,
Yes.
Clerk, yes. Thaxton,
Yes.
Miles,
Yes.
Prysa,
Yes.
Long,
Yes.
Herbert,
Yes.
McAleer,
Yes.
Spear, Birch,
No.
Sullivan, Teresa,
Yes.
Oregon,
Yes.
Chairman.
Yes.
Okay.
16 to 1.
Okay, motion, amendment 16 to 1. The motion now is ought to pass as amended. Any more discussion on this bill? Seeing none, the clerk will call the roll when she's ready.
Yeah. Did you give the CMA?
Yes, this is,
Thank you.
All right, Petrucci,
Yes.
Ammon,
Yes.
Smith,
Yes.
Rocelli,
Yes.
Clerk, yes. Thaxton,
Yes.
Miles,
Yes.
Prysa,
Yes.
Long,
Yes.
Herbert,
Yes.
McAleer,
Yes.
Spear, Birch,
No.
Sullivan, Teresa,
Yes.
Oregon,
Yes.
Chairman.
yes. 16 to 1.
16-1 consent.
You have a problem putting on consent calendar?
No problem.
Okay, all those in favor of placing House Bill 565 on the consent calendar, please say aye.
Aye.
Those opposed? So,
I'll do a
moved.
pass on a minority report.
Okay, House Bill 648, relative insurance coverage for glucose monitoring.
So Chairman Hunt, I have a amendment to it.
Just you wait.
Okay.
Okay, Representative Spears, seconded by Representative Hunt, moves,
Wait.
moves
Slow it down.
Are we on
and slow your
648?
roll.
Yes.
648. What do you want to do? What do you want to do with this bill?
No, I have this. I have the OTP motion.
So this is Spear.
Representative Hunt?
Okay.
Oh, I just want to make sure you know that I have the OTP motion.
Oh, you
in hand.
had it?
Yes.
Oh, I just had Representative Spear. Oh, you're off the hook. Okay. Representative Miles, seconded by Representative Spear, moves inexpedient to legislate? Okay.
Okay.
Okay, Representative Miles, you're recognized to speak to your motion.
Thank you, Mr. Chairman. I do move inexpedient to legislate on House Bill 648, and this bill would have required mandatory insurance coverage for glucose monitoring devices for all insured persons regardless of medical necessity. So the subcommittee and the full committee are very deeply sympathetic to the importance of diabetes management and the value of glucose monitoring technology. As a nurse, I do know firsthand how vital these devices are for patients. However, health plans already provide coverage for glucose monitoring devices when clinically appropriate. Expanding that mandate would increase premiums for all employees and employers at a time of rising health costs. So therefore, the majority of the subcommittee supported this motion, agreeing that insurers already manage diabetes and other chronic conditions effectively, and this bill is unnecessary, counterproductive to cost containment efforts. Please support the motion of inexpedient to legislate.
Okay, I know you want to speak, but I want to add one more piece to make sure everybody knows that because this is a health insurance mandate under the Affordable Care Act, otherwise known as Obamacare, that if we were to pass this mandate, then the state would be, not the employer, the state would be on the hook to fund the mandate. Okay, so I just want to make sure. So Representative Sullivan had his hand up first.
I'm just curious why we kind of using the logic that we use in the other bills, we can't do an interim study instead of ITL.
How to work? I originally had thought interim study was, was a worthy motion. but that in terms of whether where we can find the result, yes, we do have an amendment that they're potentially go forward, but
Just using the logic like you said for these other bills that we interim study, like the what was that, the denial of banking services one, like the logic you said there was just in case something comes up, if we learn something more, or if the sponsors
Right.
want to talk to us more about it, we have a little bit more time to do it versus killing it right now. So that's kind of where my instincts are
okay.
this time.
I guess she could withdraw her motion if she was willing to. You don't want to withdraw the motion. Okay, so we'll move
Question.
forward. Okay, now Representative Spear.
You said that if we were to pass the bill, then the state would be on the hook for those folks on ACA? Is that what you're saying?
It was because this only affects a small group employer,
I
an
got that.
individual.
But
So-
why is the state paying for it?
Because it's a new mandate. Not that you'll want to hear, one of my great stories, but as you know, I've been doing this job for a very long time. So way back when the Affordable Care Act was being debated, in it was what are you going to do with the fact that each state had different mandates, health insurance mandates.
Yeah.
And I always said, boy, I want to be on the fly on the wall when they decide how they're going to referee this when every state had different mandates. Notwithstanding that I was not invited in the room, but I was very intrigued by what the answer was. And the answer was that when the Affordable Care Act was signed and voted on, they put a stake in the ground and said, every mandate that a state has already passed, it's already on the books, would be covered. But that any new mandate would then have to be funded by the state.
Okay, so we passed a mandate for mammograms. Wasn't expensive, but we passed that. Does that mean the state's going to pay for it for all the ACA folks?
Mammograms predates Obamacare. We actually had it was already on the books.
No,
in
no,
New
we just
Hampshire.
did it last year.
No,
We mandated full coverage for mammograms.
no, it was always it was always.
Well,
it
we
was on-
passed something
No, she
last
did,
year.
Yeah, we did.
Added to the bill.
I guess I have to jog my memory. What we ended up passing. I remember 3D mammograms, but I'm not sure.
All
what-
right, we passed the other one on prosthetic devices for multiple prosthetic devices for kids.
All I know is that this particular one is the way this mandate would be written. It would absolutely have to be funded by the state.
How about the ambulance bill we just passed, 25% payment?
So I understand your amendment. So okay.
No, is
So,
that
all right,
mandated also?
So on to further discussion. Representative Sri has a comment that he wants to make. Keep
Well,
it
I want-
very narrow.
I want to actually, the amendment I want to discuss, I want to put a motion out to pass with amendment. So I have sent the amendment. Can you please?
Okay,
Circle
so
around.
he is urging us to vote no on the pending motion and then vote, then take up his amendment. So I will pass this around.
That way.
Oh, everybody got, oh,
Everybody's got it.
all right, everybody got it. Okay,
Oh, we do?
okay. All right, yes, Representative Horgan.
President Birch had his hand up first, so maybe, but
Okay,
You want me to go
Representative
ahead?
Birch then.
Thank you, Representative. Thank you, Mr. Chair. Before we get into, if we get into the nuances of the amendment, which I just see, I just wanted to, and I respect that I haven't been here for what have probably been very extensive discussions on this particular bill. So I don't apologize in advance, but I respect the work that the committee has done. My particular point of view is that continuous glucose monitoring is a good thing. And I gather we're not talking about it in terms of type 1 diabetes.
No, that's already covered.
Right. So we're talking about it in terms of type 2 diabetes, for which some people take insulin and some people do not.
Actually, in this
The-
bill was even further. It was just going to give these monitoring devices to anybody if anybody who wanted it. It was designed to be more of a health issue.
Just my
So-
point of view is I think the original bill could well be amended to say with physician,
That's what amendment I have put. as the-
with physician prescription.
Yeah.
So that we can just X out all the people who think it'll be fun and games to try it out. But it seems to me that for basic public health and individual health point of view is that these machines should be available through insurance if prescribed by a doctor. That's it.
Right. I would say if a doctor prescribed it, they are already covered. That, yes, they would be
Yeah,
covered
yeah.
already.
Actually, that amendment is actually exactly the same I have put, required prescription.
No, your amendment goes beyond that.
No, it's,
Your amendment
Can I-
tries to deal with the money problem.
no, the amendment, can I speak about the
Okay.
amendment?
So, no, you can't. Technically, you can't speak to your amendment. So that's why I told you to make sure you have it distributed so all the committee members
Which I did.
can read it, they can see it. So obviously, what you wanted to say is you would urge everybody to vote down the pending motion
Yes,
so that we could take up this amendment.
yes, and then make it out to pass with amendment.
And then take another vote. Yes. Okay. All right. Any, Representative Miles.
So in just reading this amendment very briefly, this,
Well, we're really
Oh,
not
no,
debating this.
okay,
bill.
that's
We're
fine.
not debating this bill. We're not debating this amendment at this
I-
point.
I yielded my place to Representative Birch, but maybe, can I speak now or?
Yes, you can now speak.
I mean, I'm just a guest in this committee, so I missed the hearings on this, but I do know that in general and with diabetes in particular, if you catch it early with monitoring, that's vastly preferable to letting the disease proceed further because that requires very extensive treatment, including insulin. So I think just from a financial perspective, it makes sense, even if we as a state have to pay a little bit extra to catch it earlier rather than let these individuals who are taking advantage of monitoring go unmonitored and then they get then they have much more serious consequences. So I'm just not I'm not uncomfortable with like what is the cost. And I know we don't know what the cost is because the fiscal note, the insurance department didn't calculate the number, but
We did do that.
Okay, I'm
The
sorry.
the insurance department gave us a 20-page report on exactly how much it would cost and who would take it up.
Okay, so, well, I apologize, and so,
I think the cost was
what was,
$10 probably per person.
We have no idea what the cost is.
We can hear from the insurance company on
Because-
that.
but
I mean-
we've never, I would have to say, we have never passed an amendment where that there was some kind of balanced billing
Yeah.
related to a health insurance mandate.
and this,
Can we call the question, Mr. Chair?
So
can I,
Representative
I-
Miles,
oh, I wasn't finished yet, oh,
well,
or maybe I'm finished.
So
Um,
insurance company must know how much they are paying right now for people who are insulin, because they're paying right now CGM to the people who are insulin. So they should know what
Okay.
it costs them for this device.
I guess I would, I'm now, as the chairman of this committee, and who very much does not want to belabor things, urge Representative Miles to withdraw her motion so we can take up an interim study motion and just have this ongoing discussion some other time.
at the request of Mr. Chairman, I withdraw my motion.
And withdraw the, all right.
So what's our
Okay.
new motion?
So Representative Spear.
Interim study.
Representative Spear, seconded by Representative Hunt, moves interim study on House Bill 648. Any discussion on the motion of interim study? Seeing none, the clerk will call the roll.
Representative Patuchik,
Yes.
Ammon,
No.
Smith,
Yes.
Porcelli,
Yes.
Clerk, no. Thaxton,
Yes.
Miles,
No.
Presa,
Yes.
Long,
Yes.
Herbert,
Yes.
McAleer,
Yes.
Spear,
Yes,
Birch,
No.
Sullivan,
Yes.
Teresa,
No.
Corrigan,
No.
Chairman.
Yes.
What's the count?
11 to 6. Okay, and we will be leaving that on the regular calendar.
Can I, no,
What was
can I,
the-
pa-
11 to 6. You,
Can I put a motion
you
out
are
to
on
pass?
the minority. If you would like
What was
to
the
submit
vote,
a
do you know?
minority report, and your
I-
minority report, your motion is going to be ought to pass on
With amendment.
amendment number
that doesn't add up.
3059.
so can I speak few minutes?
No, we're all done.
7 and 6 doesn't.
Because
equal
I'd like people to
17.
hear about my perspective on this.
No, we're
Oh,
all
11
done.
instead.
It's interim, the motion is interim study. If you would like to better educate everybody about what you think, I would recommend that you send out a email.
No, but I also put the amendment. I want to talk about the amendment, how to pass the amendment.
At
Want
this
to discuss
point,
that?
we have taken a vote, an interim study, and that's the way it's going to the House floor. And if
But-
you want to have your amendment voted on by the House floor, you will put in a minority report on this motion. And and your minority report is going to be ought to pass on the amendment. And then you are free to communicate and let everybody else know what you are thinking about.
So
with your
since
amendment.
I'm new to the process, I just want to make sure I put this amendment because I think this makes the bill much stronger. I would like to have an opportunity to speak about the amendment and put a motion for out to pass with amendment. And I want to hear no, yes, whatever they want to
No,
feel.
you're-
That's okay,
I-
but I'm not even going to give it a chance yet.
I guess you can make a motion to reconsider what we just did. But having you, I would urge you
What's-
not to do that because I'm pretty much sure you're going to lose that motion. So
I don't understand that why this committee cannot hear how to pass with amendment.
This is a legislative process, and you've just learned your first lesson about how things are done in the legislative process. There is an order in which we take things up. Okay?
Mr. Chairman,
All right.
can I take a swing at it?
Representative Smith, would you?
Sure. All right, so here's the issue with amendments. They do not exist until the pending motion is ought to pass. We were never there. We had an expedient to legislate first. That was withdrawn. Then we went to interim study. There are no amendments on those motions. You have to have a motion of ought to pass in order for an amendment to be introduced and considered. So the committee is actually forbidden to talk about your amendment because it does not exist. We never had the ought to pass motion. What the chairman was trying to explain is if you still want to do something about it, the report's going to be interim study, the majority report. You're free to write a minority report with the motion that you wish happened, which will be ought to pass as amended, I'm assuming?
Yes.
Okay, so you will also have to file your amendment with the House Clerk as a floor amendment for the calendar in January.
I will help you out with that.
Okay, so I can't put out to pass motion at this point.
At the,
No.
here, no.
No,
Okay, thank
Yeah.
you.
but you will have an opportunity to have that discussion in, when you write your minority report,
Okay.
okay? Yeah, Representative Hammond.
Just real quickly, I hope in your minority report, you'll reflect, there's two sides to the minority report. There's the side that wants all to pass and the side that wants ITL. So that's my request.
Okay.
Okay,
Oh, okay. I have a question.
Representative Oregon,
Oh,
yes.
I don't know whether I should direct this to the chair or the deputy speaker, but if in fact, the ought to passes amendment motions passes, this bill would go at least, where would this bill go after that? Would it at a minimum go to the Senate, or would it then go to the Finance Committee, or?
I don't remember whether this bill was ever going to have a second committee. I don't think, I don't remember having a second committee, so it would go on to the Senate.
Yeah, so even if we passed it, a second group of people would be looking at it anyway and could have
There will
examined
be
the.
plenty of
Yeah.
chances to,
Yeah.
that's a great thing about having a multi-camera legislature, unlike Nebraska. Okay. All right, moving right along. House Bill 706, relative to prohibiting insurance companies from conduct.
Teresa,
The motion, you made the motion, so yes, you are responsible for writing the majority report.
yes, yeah.
Yes. Okay. I do, thank you for withdrawing. Okay, 706, relative to prohibiting insurance companies from conducting an audit of provider services after services have been delivered, but before the payment has been made to such provider. This is interim study, and it's my name under it. Okay, I move, seconded by Representative Patusek, that this is an interim study bill. And I'll speak to my motion. But this bill draw through a lot of different issues in terms of what goes on right now between the provider and the insurance companies. And as much as I was hoping that the insurance department was going to come up with a resolution and how we can make this work, we just ran out of time, and it was not resolvable as easily as we would hope it to be. So at this point, my motion is interim study. Okay, any other discussion on the motion of interim study? Seeing none, the clerk will call the roll.
Representative Patuchik,
Yes.
Ammon,
Yes.
Smith,
Yes.
706.
Porcelli,
Yes.
Clerk, yes. Thaxton,
Yes.
Miles,
Yes.
Risa,
Yes.
Long,
Yes.
Herbert,
Yes.
McAleer,
Yes.
Spear. Yes. Birch,
Yes.
Sullivan, Teresa,
Yes.
Oregon,
Yes.
Chairman.
Yes.
17 zip on the consent calendar.
Okay, all those in favor of placing 706 on the consent calendar, please say aye.
Aye.
Those opposed, so moved unanimously. Okay, House Bill 721, relative to establishing gold and silver as legal tender. Representative Ammon moves interim study, seconded by Representative Hunt. Representative Ammon, would you like to speak about it?
Just briefly, we see other states adopting similar legislation like this to make gold and silver legal tender. The difference is they have a sales tax or an income tax that we do not have, so that's the benefit to them. So I think holding this bill and just seeing what's happening in other states, and maybe we can figure out a way to make this work here. There's a group in the State House in our legislature that believes in sound money. And if you wonder why the price of Wendy's takeout is $15, that's because the money's not sound. So anyway, that's the thinking behind it, that we need sound money. Interim study.
All right, or I could go to McDonald's and get a wonderful Happy Meal, or there's a discount meal, and win that Monopoly. Okay, the motion is interim study. Any discussion on the motion?
Just wanted to correct. I believe we do have a sales tax, and in fact, the committee just approved a bill that would expand our sales tax. We just call it a meals and rooms tax, and actually, if HB 106 passes, it will henceforth be the meals, rooms, and cannabis tax. But I believe it is a sales tax, and I know in a previous life when I worked with accounting databases for a company that operated in many states, we had New Hampshire right in there with all the other states as a sales tax, just it was the meals and rooms tax. So I'm just, I'm still in favor of I'm still not in favor of passing the bill. The interim study is fine with me, but like we do, in fact, have a sales tax in New Hampshire, even though we like to believe we don't, but
Okay.
thanks. That's just my opinion.
Glad you
though.
cleared that up for us. Okay.
Probably not, but thanks.
Any more discussion on House Bill 721? Seeing none, the clerk will call the roll.
Representative Patujic,
Yes.
Ammon,
Yes.
Smith,
Yes.
Burchell,
Yes.
Clerk, yes. Paxton,
Yes.
Miles,
Yes.
Presa,
Yes.
Long,
Yes.
Herbert,
Yes.
McAleer,
McAleer, oh my God, you gotta be kidding me.
Spear, Birch,
Yes.
Sullivan, Teresa,
Yes.
Okay, enough of it, you two.
yeah, it's tough to. And Horgan,
Yes.
and Chairman.
Hunt, yes. 17 to zip. All those in favor of placing on the consent calendar, please say aye.
Aye.
Those opposed, so moved unanimously. House Bill 725, relative to ground ambulance services. I move that we ITL this, right?
That's right.
Because we actually solved the problem and, so I move inexpedient to legislate and seconded by Representative Patusek. Any discussion on the motion of ITL? Okay,
When we voted, when we looked at it last time in the working session, we left it as IS.
okay.
But I'm not saying that we need to. I just want to make sure that everybody realizes we're changing the motion. And I don't care either way.
Okay. Right, well, I mean, the issue was that, we did cover it, I do remember that, but somehow my notes didn't show that. It's actually, I have my notes so that you made the motion to kill it, not me, but, all right. Any more discussion on inexpedient to legislate on House Bill, 725? Seeing none, the clerk will call the roll.
Representative Patujic,
Yes.
Ammon,
Yes.
Smith,
Yes.
Porcelli,
Yes.
Clerk, yes. Paxton,
Yes.
Miles, Presa,
Yes.
Long,
Yes.
Herbert, McAleer,
Yes.
Spear, Birch,
Yes.
Sullivan, Teresa,
Yes.
Horgan,
Yes.
Chairman.
Yes. Okay, well, 17 is it. All those in favor of placing 725 on the consent calendar, please say aye.
Aye.
Those opposed, so moved unanimously. Okay. Senate Bill 162, relative to restrictions on acquisition of ownership, controlling, and occupancy interests in real property by certain foreign principals on or around certain military installations, criminal penalties, and civil forfeiture procedures for illegal acquisition. And
What happens, my amendment part of this?
Study.
My amendment?
yeah, this is me.
Remember how I had an
You had an amendment on this one?
Yes, I did.
I compared what we had, what we ended up with after the amendment to what's in the budget and has already passed.
Right, exactly.
So
Your
it's
amendment.
word for word.
Okay.
Is already law.
Oh, okay, all right. So.
That's
this
why
is-
we don't need this bill anymore.
Okay, got it. Thank you.
Okay. All right, I'll make the motion of
ITL.
ITL.
Which one?
I'll make the motion.
162?
162,
Okay, seconded by.
ITL.
Seconded by.
And seconded by Walsh.
Okay.
Okay?
Okay.
So yes, this was tacked onto the budget.
Okay, I thought so, okay, thank you.
All right, and if you've been reading the paper, said I've seen a lot of people have said if only we had passed it sooner, it might have affected Nashua. All right, any discussion on the motion of ITL? Seeing none, the clerk will call the roll.
Representative Petrusic.
Yes.
162.
Ammon. Smith.
Yes.
Porcelli.
Yes.
Clerk, yes. Thaxton.
Yes.
Miles.
Yes.
Prysa.
Yes.
Long.
Yes.
Herbert.
Yes.
McAleer.
Yes.
Spear.
Yes.
Birch.
Yes.
Sullivan. Teresa.
Yes.
Oregon.
Yes.
Chairman.
Yes. Okay, vote 17 to zip. All those in favor of placing Senate Bill 162 on the consent calendar, please say aye.
Aye.
Those opposed, so moved unanimously. Last, Senate Bill 247, prohibiting network exclusion for pharmacies that refuse to dispense a prescription of the PBM reimbursement that is below the pharmacy's acquisition cost. We have not been able to solve this one. So Representative Miles moves interim study. Did you have this one?
I did not.
Oh, Representative Spear. Boy, my notes were really bad, weren't they? Okay.
Seconded by Miles.
We
Okay.
had a study group not this
send them
past
back.
summer, the one that we're in, but the summer before that. And we discussed what what would help the pharmacies with respect to how they can recoup their costs for drugs. And we came up with four, I guess, four things that we needed to do, that we thought we needed to do. When the bill got written, only one of the four things ended up in the bill. And on top of that, we had at the hearing a pharmacy owner who said, no, that's not the problem at all either. So the thing has to be interim studied because we really need to figure out what they want and what they need.
Fair enough. Any other discussion on the motion of interim study? Seeing none, the clerk will call the roll.
Representative Petrusic.
Yes.
Ammon.
Yes.
Smith. Porcelli.
Yes.
Clerk, yes. Thaxton.
Yes.
Miles.
Yes.
Prysa.
Yes.
Long.
Yes.
Herbert.
Yes.
McAleer.
Yes.
Spear.
Yes.
Birch.
Yes.
Sullivan.
Yes.
Teresa.
Yes.
Oregon.
Yes.
Chairman.
Yes. Vote is 17 to zip. All those in favor of placing Senate Bill 247 on the consent calendar, please say aye.
Aye.
Those opposed, so move unanimous.
Do you want to
And-
write up?
And yes, I would like you to write a blurb, please.
Okay.
Okay, so anybody who made the pending motions, please get me that blurb tonight.
Tonight?
Tonight. Got all afternoon to do it.
I'm sorry?
She got all afternoon to write it.
Mr. Chairman?
We are done. But I didn't bring I forgot my gavel. I need a blurb for the marijuana bill, yeah. Yes.
Oh, that is what.
So did you have a good time?
Okay. I want everything done
But your
by
point-
tomorrow, noon tomorrow. How's
was
that?
interesting, 'cause I didn't.
How
I
much
didn't
time do you
know
need to write a
That was
blurb?
good.
Can't you just lift the one you wrote before?
Write the no blurb.
Mr. Chairman?
That bill has been going on for a year and a half with this
Okay.
back and forth and back and forth. It is just, I would have
There's
said,
there's a bill,
rid of it.
House Bill 639, and it deals with crypto. And as a result of that, I just wanted people to know that there is going to be a bill regarding crypto. And if they want to read about it, it's on Inkleak in Manchester. It was a very well-written bill. I wish he was there 2 years ago.
Right.
If you file.
This- You know about this?
639.
639. Oh, okay.
Talk to your chief.
And the union leader. Oh, I did see Pat. I did see your editorial. Yeah. Okay. Thank you all very much. And see you on veto day.